It's good to be back with all of you. My focus in this presentation will be on vaccines. I've invited our colleague, Dr. Jesse Goodman, to speak with us about recent news related to vaccines in the United States and to provide his perspective on what we might expect in the coming months. Before I turn to our conversation with Dr. Goodman, I wish to highlight 3 recent updates to our layered public health program. As I shared last week, we would be expanding our testing protocol to include surveillance testing for vaccinated students, staff, and faculty. This will give us a sense of the prevalence of asymptomatic cases among the vaccinated members of our community. Every Monday, students, faculty, and staff will be randomly selected to receive a COVID-19 test. They will be asked to complete this test no later than Thursday of that same week. This will be a new tool for us to use to determine whether we need to revise our protocols or implement new public health interventions. In addition, we're taking 2 more steps to enhance our public health protocols. We're asking all members of our community to use a daily symptom tracker to report any COVID-19 related symptoms to our care navigators, our public health team, each day they are on campus. And we are also providing guidance regarding events on our campuses, encouraging outside gatherings, having smaller gatherings when possible, and limiting outside guests. Our campuses are also working on a process for enhanced screening for visitors, which we will announce soon. These steps are to ensure that our layered public health approach is as strong as it can be. We're tracking closely the positive cases as we begin the new academic year. Positive cases remain low. Our updated dashboard tracks the positivity rate week to week and provides information about what percentage of our on-campus community is vaccinated. On vaccination in our community, we issued a vaccine mandate for students in the spring and for faculty and staff this summer. And this also includes contractors who work regularly on our campuses. As our community returns to our campuses, we are tracking and ensuring compliance with our mandate. We are working to make access to the vaccine as easy as possible, providing access to the vaccine on our campuses. Staff are able to take paid leave to receive the vaccine and if they are impacted by symptoms of the vaccine. Now, with just a few days of classes underway, I can report that more than 97% of students on our campuses are fully vaccinated. 95% of our faculty, staff, and fellows who are coming to our campuses are vaccinated. And we expect these numbers to continue to rise as those with extensions reach full vaccination. We've seen a number of announcements in recent days regarding vaccines in the United States. I've invited Dr. Jesse Goodman to join us again and to speak with us and provide some context on the Food and Drug Administration's decision to fully license the Pfizer-BioNTech COVID-19 vaccine, as well as to talk with us about vaccine booster shots and what we can expect in the coming months. Throughout this past year, Jesse has joined us on a number of occasions to describe the process that the FDA goes through to ensure the safety and efficacy of vaccines. Dr. Goodman leads Georgetown Compass, the Center on Medical Product Access, Safety, and Stewardship, and is a specialist in infectious diseases. Previous to his time at Georgetown, he served as the chief scientist of the U.S. Food and Drug Administration and has deep experience in pandemic response.
Jesse, thank you again for taking the time to join us for this conversation. As we all know, this has been an important week. The Pfizer-BioNTech vaccine received full licensure from the FDA, and the Moderna vaccine is in the review process, and Johnson & Johnson has said they will submit their materials for review soon. What does it mean for a vaccine to be fully licensed And what is the FDA looking at when they move from emergency use authorization to full licensure?
Yeah, so it is a great week in that the Pfizer-BioNTech vaccine has been fully approved and will move to full licensure status. And the difference here with respect to the COVID vaccines is that we have much, much more information than several months ago when the emergency use authorizations were granted. Back then, we had just the first couple of months of clinical trial results that did show very high efficacy in protecting against the virus and showed a good safety profile. But now we have several months of additional follow-up. In addition, the vaccine has been utilized in hundreds of millions of people under emergency use. So FDA has all the data that's been accumulated from various databases and reporting systems from those millions of people. And then finally, during these months, FDA has been able to take the time to exhaustively go over Pfizer's manufacturing processes, quality controls, the consistency of their production, which is incredibly important in a vaccine where the process really determines the product. It's not a simple chemical like aspirin where you can just put it in the machine and say, okay, this is 100% aspirin, we're not worried. Much more complicated biological molecule. So what FDA has done is reviewed all that information in complete detail, and it doesn't just accept the manufacturer's analyses, it performs its own analyses, and then has decided that based on that, the benefits clearly outweigh the risks of the vaccine, and this has met the standard that any of the vaccines we rely on day to day to protect ourselves and our children have met. So I really feel people should take an extra measure of assurance from that this has been looked at quite carefully. And FDA has not said, oh, the vaccine has no adverse events. All medical products can have adverse effects. But with this vaccine and with an ongoing pandemic, the risks clearly are low compared to the benefits.
Now, the FDA has provided emergency use authorization for the Pfizer-BioNTech vaccine for children 12 to 15, but it has not yet approved a COVID-19 vaccine for use in children under 12. What are the kinds of questions that the FDA is looking at when approving vaccines for children?
Well, it's really important for people to remember that children are not just miniature adults. Biologically, they're really different. So you need a lot of the same information you got in those large clinical studies in adults in children. You need to see what is the proper dose. It may be lower, particularly for the lower age groups, the less than 12s. You want to see that the reactions to the vaccine are the same, both the good ones, the immune response, and then also the ones of potential concern, like the routine things like muscle aches, fevers, pain, joint pain, and also to monitor for any concerns that might not have arisen in adults. The reason it's only gotten emergency use in that population so far is a relatively smaller number of people have been studied and for a shorter time period. So FDA is going to be looking for data on additional people and over time. Even then, it's important to realize that these very rare effects that we've seen, like the heart inflammation seen with both the RNA vaccines from Pfizer and Moderna, if they only occur in 1 in 100,000, 1 in 50,000 individuals or so, you won't detect them and won't be able to define how frequent they are in those controlled trials. None are that big. And so that's why we then monitor them under emergency use and look to really understand precisely, is that occurring more commonly than was expected or not? Does it change the risk-benefit situation? And so FDA is going to be looking at that experience under emergency use with those 12 to 15-year-olds to be sure there's still that positive risk-benefit ratio.
Got it. Now, the Biden administration recently announced that starting now, it will be working to provide vaccine booster shots for those with compromised immune systems. And then later this fall, for everyone who previously received a COVID-19 vaccine. Can you talk a little bit about what could be motivating this announcement?
So it's really good to keep these two populations distinct in our minds. So it's a very different issue in both. So first, there is a clear issue that the kind of immunocompromised patients we take care of frequently, for example, at Georgetown Hospital and at specialized hospitals throughout the country and the world, who have received organ transplants, are getting chemotherapy for cancer, are getting immunosuppression like prednisone or other steroids for autoimmune disease. Those people did not respond well to the normal 2 doses of vaccine. So unlike the majority of the population, they did not get 95% protected from infection. And we and others started seeing a lot of infections in vaccinated individuals with that severe immunocompromise. And studies showed they really didn't respond to the vaccine normally in terms of their immune cells and their antibody levels. So there was a real need there. And there was some evidence developed at a couple of major transplant centers that giving a 3rd dose might bring about half those individuals into a range where we would expect them to be protected. So that was something that was pretty urgently needed for that population and very sensible. Again, it's an emergency use authorization because the data are fairly limited. And it doesn't take care of them completely. Those individuals, unfortunately, may not still be as protected by vaccine and do especially need to just be around vaccinated people and take other precautions like wearing face covering and face masks. Now, moving to the healthy population where we know they have been highly protected by receiving the vaccines under emergency use, it's a different issue. The issue is that based on data in Israel, based on some data in the United Kingdom, and some smaller amounts of spottier data in the US where we don't have a good system to track this, we've seen that it appears that protection against infection, that is just getting the virus at all, is eroding with time. And that could be for 2 factors. One is that for all vaccines, sometimes immunity wanes with time, and many of them we currently give 3 doses as part of routine immunization. That's one thing. But the other thing has been the spread of this Delta variant, which is somewhat more resistant to the vaccines and is also much more highly contagious. So with that passing of time, with the somewhat more resistant, and with this high level of contagion, we're seeing more infections in vaccinated people with the Delta variant now. And so that was seen in Israel, that's been seen in some studies in the United States, and it's raised concerns. What we haven't clearly seen yet in the US is whether that translates to people getting severe disease and ending up in the hospital or even dying. So far, the evidence in the United States is that even though we're seeing infections break through and people may get a bit sick, most, but not all, are protected against severe disease and hospitalization. CDC released a study from Los Angeles County that was just a day or 2 ago was released that showed that still the vaccines, even up to now with COVID being Delta variant almost exclusively, are about 65 to 70% protective against any infection, but that you're 29 times less likely to end up in the hospital if you've been vaccinated than if you've been unvaccinated. So there's still a high level of protection against severe disease. But getting back to your question about boosters, what everybody is concerned with is Israel has said they're starting to see some slipping of protection against severe disease. And even here, it's not 100%. So I think it's very appropriate for the administration to say, we need to consider, or even for their scientists based on this data to say, we really believe we're going to need to move to a third dose of vaccine, and even in healthy people. The problem is we haven't seen that data yet. We haven't seen it in the US. We haven't seen it clearly from Israel. And also the studies of booster doses that need to be submitted to FDA to show that they have the desired effect, that the safety profile looks good, have not been completed yet. We've just seen some initial reports. So it's a little bit of the cart before the horse, and a lot of people have been somewhat critical of this announcement. Personally, I feel they're right to prepare the states and the American people for this possibility because we may well need it. But I think it probably would have been better to say, this is what we see happening. We're getting ready and preparing to do this, and we think we might have to do it in the fall. And we're continuing to track data on the virus and get the clinical studies completed into FDA, and we'll keep informing you about progress and decisions on that. I think for a lot of reasons that would have been a preferable approach, but we are where we are. And the good news is the data will be brought before public advisory committees like CDC's Advisory Committee on Immunization Practices when the time comes.
And Jesse, how is the vaccine effort proceeding globally? Should we be concerned that implementing boosters in the US will impact global vaccine supply?
Well, certainly the optics are concerning. There's large swaths of the world where, essentially no one's been vaccinated, and certainly not in many places, even the highest risk people like healthcare workers. So, I feel a lot better being in the hospital seeing patients when I've been vaccinated, and so did all the staff, particularly that deal with COVID patients all day long. So I do think that it is a higher priority to get the world vaccinated than to get booster doses. However, that said, I do think we can do both. And the administration deserves some credit for making quite a number of commitments to increase global supply. And I don't think the 100 million doses or so that we're talking about if boosters are needed in this country, in the next few months, it's kind of a very small piece of the global solution. But that said, I think it's another reason to be really sure that we're transparent and clear about our decision-making if we go to boosters in this country, and also to be really clear about what we're doing to help the world with supply. Those efforts, are being increased, but I think there's not a strategy, a plan, and an end game. In a positive sense, it's kind of remarkable that more than 4 billion doses have been used in the world. I was surprised to recently hear that. But a lot of them are in large countries that don't really fit into the less developed paradigm, like India, China, et cetera, but larger countries in Latin America. But when you go to the most disadvantaged places like Africa, less advantaged countries in South America, immunization rates are still way too low. And it's not just a humanitarian crisis. I mean, it's not just that, you have a picture. I mean, I hate to say it, we have the same thing in some of our states now, in Arkansas and Missouri, where people aren't vaccinated. But it's not just humanitarian. Remember, the Delta variant came from overseas. As long as there is rampant infection, whether in the US or overseas, the virus keeps mutating, and that provides a source for new variants that conceivably could overcome, to some degree, our treatments and our vaccines. So, this is something that, for very self-centric reasons, controlling the global outbreak is also critically important.
Jesse, can we go a little bit deeper into the relationship between variants and the vaccines? We're in a fourth surge here in the United States, really driven by a variant, the Delta variant. What are the questions that scientists, the FDA, vaccine manufacturers are looking at as they look at vaccine efficacy over time? Will we see new vaccines developed for new variants? How does this dynamic work?
Yeah, it's a really important question. So some of these variants, when we look at blood from people who got inoculated with the original vaccine based on the Wuhan strain, what we can see is the antibodies in your blood are much more effective against that Wuhan strain than, say, some of the new variants, the one that originated in South Africa and the one that originated in India, particularly, also against one that's originated in Brazil. So there's still work. They still can kill the virus, but it requires higher amounts. So that's why with time, that protection may go down. Okay, so we may be looking at a situation like we have with influenza, that as the virus changes, we may periodically need to change the vaccine. And so, for example, right now, if it were available, which it's not yet, it might be preferable to use a Delta-based vaccine against this global Delta outbreak. The studies show that boosting people with a Wuhan-based vaccine will help raise those antibody levels. And in Israel, they believe they're seeing increased protection with the booster doses against Delta. But we need to study, immunization against these new variants and be prepared for them. And that's one of the things where I think, a global public health strategy and the US and the WHO working with manufacturers to be sure we're paying attention to that long game of the global public health agenda well beyond September. And I would add one other thing I think I touched on early on. Israel and the United Kingdom have healthcare systems with integrated data. So they're not fragmented into gazillions of hospitals and systems whose data largely can't talk to each other and largely the government can't access. So they've been leading the world in analyzing, is vaccine staying effective? We need to build that capability in this country. We've known we've needed it. It can be done even with our fragmented system, because then we would be much further ahead now understanding, are we going to need boosters here? And also, as you alluded to, there will be future variants. Even if everybody does get a booster in the fall, we're going to have to monitor vaccine effectiveness going forward to be sure it doesn't decrease with time, or if new variants occurred, there isn't a need for a switch in the vaccine or another dose. So building that capability, so we're not just seeing one study from LA and one study from the Mayo Clinic, but sort of have a national surveillance strategy. That's an example of an important role for government here.
And Jesse, big picture, could you talk about what you see as the overall direction of the pandemic? Are there particular reflections you have on what we might expect over the next few months? What does the future look like?
I think it's really important to emphasize that no one can predict the future with this virus and this pandemic. And every time we felt we know what's going on, something new happened. So I think it's really important as we face forward to always have multiple planning scenarios, like we've had at Georgetown. We believe we can bring people back in class and with proper safety measures do that, but we're going to monitor and we're going to be prepared to adjust. And I think the global strategy has to be that way too. I do believe that in many of the unvaccinated areas, for example, in our country, in some of the worst areas where Delta has been causing such a toll, cases have really peaked. Hospitals are horribly stressed. Many people are dying. It's a daily tragedy. It's an avoidable tragedy. But it's burning through those populations. People are getting the message and more people are getting vaccinated. So I'm sort of hopeful that this Delta wave may not go on forever. I don't think it's going to be over in 1 month, but it could be several months. But beyond that, we just don't know. As I said, we need to get the rest of the world vaccinated. I think if we can, and we can get a sense of national purpose around this. And those people who basically don't even believe there's a pandemic or that they're at risk, that hopefully those numbers go down as they understand, how they can protect themselves and their family. I think we can make progress. We will get through this, but I think there will continue to be bumps along the road.
And Jesse, as we close, is there anything you'd like to share with our Georgetown community?
Well, I saw in Dr. Mashuri's note today that 95% of people on campus are immunized, and I would say, fantastic, you're taking good care of yourself and everyone else. That's an accomplishment. I know this has been terribly hard. I'm sure much harder for students even than faculty, and very hard for parents. But I'd say we're trying to get all the right balance of how to take care of ourselves and our community, but also, move forward and go on with all the other things in life. And, as I said, we've got a lot of tools. We've got good vaccines. We're starting to have more treatments. But we also still are at the point where individuals' personal responsibility to the community is really important. And I think with the virus circulating, wearing masks indoors is going to be important, at least for now. And certainly not only having yourself vaccinated, but, doing everything you can to encourage your loved ones and others to get vaccinated. Those are all going to be really important things.
Jesse, I want to thank you again for taking your time and for sharing your expertise with us. We are so grateful for your leadership in our community.
Well, thanks a lot. It's been, just a privilege to work with the Georgetown community. Thank you.
And I look forward to being with all of you again next week. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.